Hi friends, once again good evening and welcome to my channel Mukambika Nursing. Friends, in this video we can see the next set of questions for exam preparation. In the first three set we saw 15 question and 45 question till 45 question we completed. Here we can see the 46th question. The nurse is reviewing the record of a client with Crohn's disease. Which stool characteristic should the nurse expect to not document in the client record? And the options are option A diarrhea, option B chronic constipation, option C constipation alternating with diarrhea, option D stool constantly oozing from the rectum. Here question is a nurse is caring a patient with Crohn's disease and which stool characteristics does she note in the nurse's record? That is the question. Here we have to know what is Crohn's disease, so easily we can answer the question. Crohn's disease means an inflammatory disease that occur anywhere in the gastrointestinal tract, but most oftenly it affects the terminal ileum and which leads to thickening and scarring, a narrowed lumen, fistula and ulceration and abscess. That is Crohn's disease. Here this Crohn's disease is characterized by non-bloody diarrhea of usually not more than 4 to 5 stools daily. Over the time, the diarrhea episode increases in frequency and duration. So, the here correct answer is option A, diarrhea. And the remaining signs and symptoms we can see cramp leg pain or colicky pain after meals, fever, and abdominal distension, anorexia, anoxia, vomiting, weight loss, anemia, dehydration, electrolyte imbalance. Everything occurs. This all occurs for the patient, but this constipation and constant stool constantly oozing from the rectum, this are all not related to this Crohn's disease. Here, correct answer is option A. Question number 47. The disease characterized by 4 A's of bluer is. Options are option A MDP, option B OCD, option C schizophrenia, option D delirium. So Bluer's 4A is the characteristics features of option C schizophrenia. Okay, that is the correct answer. Schizophrenia is a thought disorder that impairs judgment, behavior, and ability to interpret reality. It is a thought disorder, and the Bluer's 4A include ambivalence, affect disturbances, autism, and association disturbance. That is the 4A ambivalence, affect disturbances, autism, and association disturbance. This is Bluer's 4A in schizophrenia. Here our question is option C schizophrenia is correct answer. 48th question. Persistent or recurrent tendency to observe persons engaged in sexual activity is termed as. Options are option A fetichism, option B voyeurism, option C frotteurism, option D zoophilia. Question is continuous or persistent observation of persons engaged in sexual activity is termed as. That is the question, and correct answer is option B voyeurism is the correct answer. Voyeurism means is a tendency to observe persons engaged in sexual activity, and the remaining option we can see fetichism. Fetichism means that is sexual arousal occurs with a non-living object, that is called fetichism. Frotteurism means it is also a sexual disorder in which patient involved in the act of touching and rubbing persons usually of other sex. Touching and rubbing a persons of other sex is called frotteurism, and zoophilia means sexual act with animal is called zoophilia. Here question is recurrent or persistent tendency to observe person engaged in sexual activity is called voyeurism. Option B is the correct answer. And the next question 49. Profuse pink frothy sputum is the characteristic sign of. Options are option A viral respiratory tract infection, option B left side heart failure, option C pulmonary edema, option D all of this. Question is profuse pink frothy sputum is the characteristic sign of pulmonary edema. Option C is the correct answer. Okay, and we'll see the next question. Question number 50. Dose of tuberculin test is. Options are option A 0.1 ml, option B 0.3 ml, option C 0.2 ml, option D 0.4 ml. Question is dose of tuberculin test is. Correct answer is option A 0.1 ml is the correct answer. This tuberculin test is also known as Mandos test. Okay, this test is mainly done for TB patient. In this tuberculin test, the purified protein derivatives is injected into the inner aspect of the forearm. Where it is injected? It is injected in the inner aspect of forearm. And the route of tuberculin test is intradermal, and the dose of tuberculin test is 0.1 ml. Here our question is dose of tuberculin test. So it is correct answer is 0.1 ml. Option A is the correct answer. And the time needed to read the Mandos test is 48 to 72 hours. These are all important points. The time needed for reading Mandos test is 48 to 72 hours. Okay. Question number 51. Route of tuberculin test is. Options are option A subcutaneous, option B intradermal, option C intramuscular, option D intravenous. Here question is route of tuberculin test. As we already saw in the previous question, the route of tuberculin test is, or the route is intradermal injection, and the dose is 0.1 ml. It is given in the inner aspect of the forearm. Okay, that we already saw in the previous question. And the time required for to read Mandos test is 48 to 72 hours. Okay, these all are important points. Question number 52. Which type of food decreases the absorption of levodopa? Options are option A high protein, option B low protein, option C high fat, option D low fat. Here question is which food item decreases the absorption of levodopa? Correct answer is option A high protein diet. Okay, here food that is high in protein decreases the absorption of levodopa. Levodopa is the dopamine replacing agent and is used for the treatment of Parkinson's disease. So in food with high protein decreases the absorption of levodopa. Question number 53. Which type of food can be restricted for a patient taking warfarin? Options are option A cereals, option B liver, option C green leafy vegetable, option D both B and C. Question is which food item can be restricted, cannot be used for a patient taking warfarin? That is the question, and correct answer is option D both B and C. That is both liver and green leafy vegetables contain vitamin K. Vitamin K is an antidote of warfarin. So, patient who is taking warfarin sodium should avoid both liver and green leafy vegetables. And the correct answer is option D, both B, liver, and C, green leafy vegetables. Question number 54. Diagnostic procedure which involves removal of pleural fluid for analysis of. Option A parasynthesis, option B thoracynthesis, option C bronchoscopy, option D pleurodosis. Here question is diagnostic procedure in which removal of pleural fluid for analysis is called option B thoracynthesis. Thoracynthesis means puncture by a needle through the chest wall into the pleural space for the purpose of removing pleural fluid. Pleural fluid include blood, serous fluid and pus. Okay, so the pleural fluid is removed for the diagnostic or therapeutic purpose is called thoracynthesis. The amount of fluid that is removed is usually about 20 to 30 ml for diagnostic purpose. Okay, remaining options is there Bronchoscopy means the visualization of tracheobronchial tree. And option A, parasynthesis is there. Parasynthesis means removal of fluid from the peritoneal cavity. And here question is removal of fluid from the pleural cavity for analysis is called thoracosynthesis. Option B is the correct answer. Question number 55. Route of administration of measles vaccine is option A intradermal, option B subcutaneous, option C intramuscular, option D oral. Your question is route for measles vaccine. That is the question, and the correct answer is option B subcutaneous route is the correct answer. The measles vaccine 0.5 ml is given through subcutaneous route at 9 months of age. Okay, and the immunity develops 11 to 12 days after vaccination. And MMR vaccine also can give this on 15 to 18 month of age, that is also 0.5 ml by subcutaneous route. MMR vaccine means vaccines provide immunity against mumps, measles and rubella. Question number 56. Immunization is a method of. Options are option A primary prevention, option B secondary prevention, option C tertiary prevention, option D primordial prevention. Here question is immunization is a method of. Option A primary prevention is the correct answer. Primary prevention means action taken prior to onset of disease. Here immunization come under specific protection. Specific protection is one of the preventive measures for primary prevention. The specific protection methods include vitamin A, iron and folic acid supplementation, immunization, quarantine, and use of condom in case of HIV and sexually transmitted diseases. So here immunization is a method of primary prevention. Option A is the correct answer. And we'll see the next question. Question number 57. During measles, rashes occurs in. Options are option A prodromal phase, option B eruptive stage, option C post measles stage, option D all of this. Here question is in measles the rashes appears in which stage? Okay, and the correct answer is option B eruptive stage is the correct answer. The clinical manifestations of measles include prodromal stage, eruptive stage and post measles stage. In eruptive stage, rashes usually appears on the 4th day of the disease, and the rashes first appears behind the ear, on the face and the neck, and then rapidly spreading to the trunk and extremities within 3 days. So here rashes first appears behind the ear, on the face and neck. Okay, here our question is rashes appears in which stage? That is option eruptive stage is the correct answer. And the next question 58. Rashes of rubella first appears on option A face, option B abdomen, option C trunk, option D legs. Here correct answer is among this option A is the correct answer. Okay, face. The rashes first appears behind the ear, on the face and neck. Among this option face is there, so face is the correct answer, option A. Question number 59. In India, most of malaria cases are reported due to. Options are option A Plasmodium falciparum, option B Plasmodium malaria, option C Plasmodium vivax, option D Plasmodium ovale. Your question is most of the malaria cases are reported in India due to option A Plasmodium falciparum. Approximately 50% of cases are reported due to the Plasmodium falciparum, and about 5 to 8% of cases are occurs due to mixed infection. And the second most common cause of Plasmodium infection is Plasmodium vivax, and the first most important cases are in Plasmodium falciparum. Question number 60. Most common type of plague is. Options are option A bubonic, option B pneumonic, option C septicemic, option D all of this. Here question is which is the most common type of plague? Okay, and the correct answer is option A. Bubonic is the correct answer. Bubonic plague is the most common type of plague. In this type, bubo is an enlarged tender lymph node which develop in groin, axillary area, neck, and the patient may experience fever, headache, chills, and painful lymphadenitis may occur to the patient. So here our question is, which is the most common type of plague, and the correct answer is option A, bubonic.